Hey guys, so we're back going over the rest of these lab slides just so y'all can have them as a companion to your other stuff. I'm working on getting lab test number 5 and lecture test number 5 up for you guys today. I should have those up today. So we're starting here. This is the next video in this series. Again, guys are gonna have to put in some work, and I know it is not fun. It's stressful and all that, but we're gonna have to just get this stuff done. So make sure you get out your white lab binder and kind of go along with this, because like I told you, practice tying your tourniquet, practice your introduction, your identification, your medical interview. Go through these things step by step so that you will remember. Practice, practice, practice. Y'all get that red bag out. Get your stuff out. Do like I told you when you were in lab class. Remember I said, hey, when you go home, you need to be practicing tying this tourniquet. I can tell if you're not practicing. Use some gloves, okay? Most of you should have took gloves home with you. You want to be practicing this stuff with your gloves on, okay? So reuse your gloves. Just kind of, if you're just using to practice and it's not any blood or body fluids, it's okay for you to take them off inappropriately right now so that you will have them, so that you can keep reusing them, so that you can practice tying that tourniquet with your gloves on, okay? So pause each one of these. I'm going to go through them pretty quickly, okay? This is talking about arterial blood gases, ABGs, okay? And you'll see this is our rec, right? And the most important consideration for ABGs, whether it's a skin puncture ABG or whether it is drawing from the artery, is exposure to room air. You want to limit the amount of room air exposure to these samples as much as humanly possible. Okay, what's our specimen source going to be? Right? So different, right? Typically it's a capillary or it's venous. But today we're talking about arterial blood, right? Okay, you always want to note that, okay? And then remember, I showed y'all those 3 different syringes, the little bitty TB syringe, the arterial blood gas syringe, and then a regular syringe that we use for drawing most of our other blood with, right? So make sure you go through this, pause it, okay? What section of the lab would this test be delivered to, okay? Look on Appendix A, okay? Make sure you're studying Appendix A. So this is a YouTube video. Guys, I love YouTube. Googling YouTube, everything having to do with the internet is not great, and social media is not great, but there's a lot of great things out there. And going on YouTube, and like I said, y'all are going to get as much out of this as you put in. You need to take those extra steps to go on to YouTube. Copy and paste this out of here or write this down and then go on there and watch them doing arterial blood gas. Go online and watch as many videos about drawing blood as you can watch, okay? Make sure you're getting some pretty reputable ones done by educational institutions or hospitals or things of that nature. So watch this video, follow along, and make sure you're reading through each and every one of these worksheet labs. Visualize in your mind you're doing it, okay? Practice tying the tourniquet. Practice doing your introduction and your identification in your medical interview, okay? So here is worksheet 23B, which is an infant heel stick, right? For a total bilirubin and conjugated bilirubin. And again, go through these things. Page 195 in your lab binder, it starts off with wash hands and select appropriate PPE. I want y'all to go through this. I know you may seem silly, but walk through it. Like when you have to give a speech or when you have to do something, you practice it, right? If you want to be really good at giving a speech or a presentation, you want to practice it. You want to time yourself when you're doing it. Time how long it's taking you to tie that tourniquet properly, right? Go through these procedures. Practice them out loud. Mimic. Act like you're an actor, that you're acting something out. Go through each one of these, okay? Do your introduction, do your ID, do your medical interview, okay? It goes all the way through. It talks about cleaning your site with 70% isopropyl alcohol using concentric circles. Allow the baby's heel to air dry without blowing, wiping, or fanning, right? And then you need to perform your heel stick. Wipe the first drop away. And remember, what's the most important thing? We want to make sure that that our heel is warm. We get 7 times more blood out of a warmed finger or warmed heel. You want to make sure you use the appropriate lancet for infants. Remember, it's 2 millimeters or less for an infant, right? You want to hold that lancet down on either side. Remember, we don't go directly in the middle on the finger or the heel because we worry about puncturing that bone, right, and causing osteomyelitis, which is an inflammation or infection of the bone, right? So you go to the side, but you want to hold it down really, really hard, right? Because you only want to have to stick them once. So it's really warmed. You're over to the side. You're using the appropriate lancet for an infant. Push it down really, really hard. Depress your trigger. And then once it pops, the lancet pops the heel, still holding it down really tight. You say 1, 2, right? We want to wait that 2 seconds because we want to get that really good stick. I know it hurts and it seems cruel. I know it bothers everybody, but you'd rather get a really good stick so you can collect all the blood you need so you're not having to puncture the infant more than once. Then, the minute that happens, the lancet goes directly into the sharps container, right? We don't lay it down. We don't do anything. Directly into the sharps container, right? Then we wipe away that first drop of blood, and then you go through, right? All right, collect your blood. And this is a total bilirubin, a conjugated bilirubin. So we're going to collect it in an amber colored specimen container, right? Micro container. Now remember, most of the time, and y'all will notice this when you're in lab, your red tops, your SST tops, your green tops, all those that you did for venous, drawing of venous bloods, they didn't come in an amber color, okay? Normally, the only amber colored collection vials you're going to see is those amber colored micro containers for finger sticks, for capillary sticks, for heel sticks, right? That kind of thing. What you would do with let's just say you drew a green top for it or a red top for it, right? And you got to transport to the lab, right? And it needs to be protected from light. You're going to have some foil on your tray. You're going to have something on your tray that you're going to wrap around that tube. As soon as you get through drawing it and label your tube, you're going to wrap that aluminum foil or wrap something around that tube to shield it from light till you transport it and deliver it down to that lab, okay? Unless your department, unless the place you work for does actually have some type of collection device for venous collection that is amber color, but typically you only see that in micro containers. But guys, please, 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 like I said, I want y'all to be successful. But it's going to take hard work on your part. Make sure you're going through your lab manual. Read each and every one of these things all the way down to appropriately throw in your trash away. Run through this in your mind. Practice it out at home. Remember how we kept all our piles, right? Your dirty piles and your clean piles, right? Because we want to be able to keep them separated, because if something that has blood or body fluid on it touches something that is clean, then it's no longer clean, right? Then it all has to go in the biohazard. So remember, practice, practice, practice. I can't say this enough, guys. Please do this, okay? So here we go. It's just like I was telling you. You're going to, if you see the little arrows there, right? So we're going to use, okay, so right there, right? Right there, right there, and right there is where we want to stick them. Never in this area right here, okay? Because that we'd hit that bone, right? Okay? And like I said, stick on either side of that heel, and you want to use that pediatric lancet that's less than 2 millimeters. Fill your amber micro container to at least 250 microliters. And the only way you're going to be able to get enough blood to fill that micro container to 250 microliters is if that heel is warmed and you get a good solid puncture on there so that you will get good big drops of blood, okay? So now here's another requisition, worksheet 23C, right? Pediatric collection, drawing blood from the ana cubita fossa of the arm, right? So now our specimen source is going to be venous, right? And so your patient info would already be filled in. I want you to look on Appendix A at a CMP, Comprehensive Metabolic Panel, and see what tubes you can draw. What tube would you choose? Talking about turnaround time, right? We want to make sure that we use the best tube we can for turnaround time. Now, please, guys, turn to that page in your lab manual, in your white lab manual, which should be page 197, right? And start from number 1, washing your hands as appropriate PPE. Go step by step by step. Like step number 13 is entered vein, bevel up with fingers positioned on holder with thumb at the top, other fingers below, right? Draw tubes in correct order. Do not switch hands. Do not withdraw the needle from the arm or change positions of the needle. Keep the needle pointed down, right? Please, guys, read over these, read over these, read over these. The only way y'all are going to learn this, visualize you doing it. Remember what you did in lab when you were in lab, okay? So pediatric drawing from the antecubital fossa is exactly the same as the adult. So you notice it says rubber band, but that's your tourniquet that's tied about 4 finger lengths from your area, right? And then there's your, the same thing, okay? All right, so now 23D, pediatric collection, drawing blood from the dorsal hand. Here's our requisition, right? Y'all go through this stuff. Follow through with it. Go step by step in your white lab binder, okay? You want to know what color tubes. This is total bilirubin, conjugated bilirubin. What tube colors should be drawn. In what order, right? What section of the lab does it go to? What special handling do these tests require? Please study Appendix A. This is important stuff, guys. Remember, you use your requisition to be able to tell what your doctor's order. You use it to fill out important information that you find out from your patient. You use it to properly ID your patient. You use it to take the label and put on your specimens once they've been collected. And you use other labels to put on your patient log. Okay, so pediatric correction, drawing blood from a dorsal hand. Guys, use YouTube to your advantage. Like I said, this is extraordinary situation. This is something that has not happened in my lifetime, or most people have never seen the situation that all of us are going through. But we're in this together. We will not let this stop us from getting what we want. Okay? I'm helping you all I can, but you guys are going to have to go that extra mile so that you're going to learn as much as you put in here. Get on YouTube. There's lots of videos out there that will show you how to draw blood from the dorsal hand of a child. And if you'll see, there's that needle, right? With the little hub, right? So you're going to use a finger tourniquet, which is scissors fingers around the wrist, thumb, and pushing down. And then you use a 23 gauge needle to collect the blood directly into the microtainer. So in other words, once that needle right there goes into that vein and you use your hand right in here as a tourniquet, okay? Then out of the hub of that needle, you will drop that blood, will drop down into that microtainer till you fill it out. There are videos online that show you pediatric collection from that dorsal hand. When you get an opportunity, you guys, even if you say, I can't do that right now, I got to study for these tests, I got to take lab test, lab quiz number 5 and lecture number 5, and then I got to start studying for my final. And even though I'm not taking a 6th test in lecture or lab, I still am responsible for that information, so I've got to do that. I don't have time to go and do this. Okay, I understand that. You do need to set yourself up for success. But the minute you're through with your final, go back to these. I'm going to leave these up on YouTube. Go back and watch them. Go look at videos online about this particular thing. It'll show you where you can better see how it's done. Okay? Look in your textbook for this kind of information, because visually I can tell you how to do it, but visually you need to see how it's done. Okay? So you can get a better example. But if you guys will go through these labs one by one and read them over and over again, when you have time, it will help you visualize it and learn how to do it. Okay? So, again, going on, we're talking about pediatric collection, drawing blood from the scalp vein. And y'all guys, we would not have done this on real people in the lab. We would have used our plastic baby dolls and we would have performed them on them. Okay? This is something that you're going to have to be a phlebotomist for a while before they're going to entrust you to do pediatric collections. Okay? But these are things you need to know. There are videos on YouTube showing you how to do pediatric drawing from scalp veins. This is not something you do every day, and you wouldn't do it as a brand new phlebotomist or when you're doing your rotations. But I want you to have as much information as you can, so when your time comes to do something like this, you can pull these memories back from your file and know how to do it. So make sure you're reading through this. Pause this slide, read through it, follow along with get your white lab binder out. Read this stuff, okay? Go through it. Go onto YouTube and see if you can find some videos so you can visually see it, okay? And here's some pictures, okay? And we apply a rubber band is what we use as a tourniquet, right? And we wrap a little piece of gauze around it, okay? And then once you wrap that around there, those veins will pulse up in there, and then you find the vein, okay? You find the vein running vertically in front of the ear, right? See it in this picture, that bottom picture down there? Okay? And then once you find it, and you can feel it, and you see it, and you visualize which way it's going, then you take that tourniquet off, you clean with alcohol, iodine, or chlorhexidine, you let it dry, okay? You've already shaved that scalp, right? Then you use sterile water to wash it off. You reapply your tourniquet, enter the vein at a 15-degree angle using a butterfly needle with or without a syringe. Release the tourniquet and then fill your collection tubes. Please, guys, do yourself a favor. Go out there on YouTube and watch some videos so you can really see this being done, okay? Okay, so 23F, we're still talking about pediatric collections. These are all the different pediatric collections, okay? And there's Nadelson tubes. These are those tubes that has the little flea in it. We talked about it in lecture. And remember, what you're doing is taking everything you learn in both lab and lecture and putting it together so that you will know exactly how to do it when you get out there in clinicals. And I'm really hopeful that we will be able to get back in the lab sometime before the summer's out, before you guys have to go to clinicals, so that a lot of this stuff, I'm going to be able to run through it in a boot camp so that you will have hands-on holding that baby doll in class and being able to go through this so you can see what that Nadelson tube looks like. But when you draw the blood, these blood gases on babies, it's a lot like it. We want to limit the exposure to room air as much as possible. So the better stick you can get that Nadelson tube filled up, get that little metal flea inserted inside that tube, seal off both ends, and then take your little magnet and run it back and forth on the outside, and it moves that flea back and forth inside that blood and mixes that blood with the heparin that's in that tube, okay? So again, our requisition slip in real world would already have all our patient information on there, and we would use that to identify our patient. We would note on our requisition that this was capillary blood, right? And so make sure you pause this and go through this, right? Okay, so this is that procedure. You always warm that heel, right? And we always use a pediatric lancet, right? And this will tell you, pause this, read through it, follow along in your lab manual, and go online and find any YouTube videos you can find to show you how this is done. And of course, it's an ABG. So what are we going to do? We're going to transport this specimen to the lab in an ice water slurry. And remember, guys, it's like I told you, from A to Z, right? So whenever we finish doing any of our labs and we're dealing with blood or body fluid, we always want to make sure that we dispose of our waste properly. That's why we keep our separate piles. Our clean pile isn't anywhere near our dirty pile, right? You think before you toss. You don't want to endanger someone's life. We always make sure we put all our stuff away, clean everything, being well organized, and having a clean and well organized workstation eliminates accidents and injuries, okay? We would always neatly fold up our lab coat and place it in our plastic bag so that we don't spread any germs from that anywhere else. And lastly, we remove our gloves the proper way so that we can throw them away in the trash bag, in the regular trash. Okay, guys, I'm getting these out as fast as I can, getting your test up as fast as I can. If you have any comments, questions, or concerns, please get with me. I'm going to put out dates on your, I'm going to check your lab, your lecture final, see when it is, your lab final, and the rest of your case studies. If you have not already turned them in, and I will make sure I get that out to you ASAP. So follow the videos in line, okay, and then fill out your study guides for the chapters. See you on the next video.